For those who don't know me, my name is Tammy Jordan. I am the registered dietitian with Viva Eve. And June is Global Infertility Awareness Month. So we thought this was a great time to be talking about this really important topic and just really getting awareness out there. There's been a huge improvement in assisted reproductive technology, but I feel like there's still a really big gap in education around natural ways that you can boost your fertility. So this is what I'm going to be talking about tonight. I have 2 kids myself. I have friends and family that have struggled with fertility issues. So I know I can really relate to the anxiety and a lot of the questions that regularly come up. So I'm hopeful tonight I can answer some of those. So to start with, just a bit more about myself. So I am a registered dietitian. I always specialized in women's health. I have worked in hospitals and healthcare settings, lots of different places, but my my real passion is helping women and some men improving their health and well-being. My training, I did my undergraduate degree in the UK, where I'm originally from, and my master's degree here in New York City. And I'm just excited to be here. So, who is Viva Eve? So we are a leading women's health destination that served the New York community for over 30 years. So in addition to this beautiful office, we also have locations in Forest Hills and Astoria. We're a diverse team of top-rated specialists, doctors and nurses affiliated with Mount Sinai Hospital and among others. We are known as the fibroid specialists. So we perform a lot of uterine and fibroid embolisms. We're really the product of listening to what our patients want. So we offer friendlier staff, a comfortable and serene surrounding, and bedside manner. Right, so nutrition at Viva Eve. So we recognize that women's health is a lot more than just standard conventional medical care. So we are now introducing a range of personalized women's wellness services designed to make you feel your best and live your healthiest life. So since starting with Viva Eve, I have created a number of customized nutrition and wellness programs. In addition to preconception and fertility, I also have developed programs around pregnancy, 4th trimester, so once you've had a baby, hormonal balance and PCOS, also fibroids, weight management, and chronic conditions such as diabetes, gastrointestinal conditions, autoimmunity, full spectrum. Right, so here's just an overview of what my presentation is going to be about tonight. So I want to start with giving a definition about what infertility is, how common it is, the causes, and then I just want to spend some time doing a deep dive into the research. So what do we know about the connection between nutrition and fertility, as it specifically relates to ovulation disorders and egg quality, as those are the kind of 2 areas that we got some really good research on. I'm then going to take you on a bit of a patient journey and show you how I typically work with people, what the types of things that I cover, and how that works. I want to give you some tips to go away with today, ways that you can enhance your fertility, and also some helpful resources. So if you have questions further down the line, something you can come back to. Right, so what is infertility? So there are broadly 2 definitions. Firstly, it's the absence of pregnancy after 1 year of unprotected intercourse under age 35. The second definition is that it's for women 35 years and older. Infertility is the inability to conceive after 6 months. And the stats are really startling. So infertility affects around 6.1 million people in the US. That's around 10% of reproductive aged population. And it really impacts both men and women. So that's really important to be aware of. This graphic just illustrates that. So the research indicates that around a third of infertility cases are due to some kind of women's issue. A third is to do with male factors. And then the remaining third is a combination of both partners, or it can also be unexplained infertility. So what are the main causes of infertility? So we know in the last 30 years, the rates of infertility have just skyrocketed. And it's thought that there are two main new drivers. Firstly, there's been now a modern trend of postponing childbearing later in life. So a lot of women are waiting until their late 30s and 40s to start a family. So we know that after age 35, there's a steep drop-off in the rates of the probability of conceiving. We also know there's now, in many of the bigger cities, a greater exposure to environmental toxins. So I'm going to be touching on that a bit more in this presentation. And then there are reproductive conditions. So ovulation disorders, semen abnormalities, tubal defects like blocked fallopian tubes, unexplained fertility, and endometriosis. So it's important to note though that if a couple is having infertility issues, if there are any anatomical or structural reasons for that, then it's important to see your OBGYN to rule that out. So you can eat the best diet and make all the lifestyle changes that you can, but if there is a structural reason why you can't get pregnant, then nutrition can only do so much. I firmly believe that everyone can benefit from medical nutrition therapy for fertility, but these are just some examples of the types of patients that I might see. So the first is women that have anovulatory cycles. So these are menstrual cycles in which ovulation is just not occurring. So it can be for many reasons. Coming off birth control, that can take your body a bit of time to rebalance. You could be overweight or underweight, you could be excessively exercising, or it could be stress. I also see a lot of women with polycystic ovary syndrome, so PCOS. So this is an endocrine condition. I like to think of it as a cluster of symptoms and signs. For some women, those signs can be very overt, excess hair growth, weight gain. It can show up on ultrasound cystic ovaries, or higher and imbalanced blood sugars, prediabetes and type 2 diabetes, celiac disease, mainly because of micronutrient deficiencies, general weight concerns, eating disorders, women that just want to optimize their assisted reproductive cycles, so IUI or IVF, and also for men, improving sperm quality. And for this, the main focus of this presentation is on women, but the helpful resources, I've included some information for men organizations. So when it comes to the research around nutrition and fertility, more needs to be done, but there is an amazing study called the Nurses' Health Study. It is still ongoing. It was launched by two professors at Harvard, Jorge Chavarro and Walter Willett, and it's now in its third phase. So it started in 1989, and it really involved interviewing 160,000 nurses. So they chose nurses because they knew there would be a high level of compliance, so they would send them a health questionnaire every year, and it would ask them about their diet, lifestyle, what had changed in their lives. So they were able to really see how lifestyle factors, particularly diet, were supporting their health. The main focus was actually on breast cancer, but they still had all this information that they could use to look at pregnancy and fertility. So when they specifically looked at fertility, that sample was boiled down to around 20,000 women who said they were trying to get pregnant. And it looked at which factors impacted anovulation. As I mentioned earlier, that's one of the most common causes of infertility. So it was trying to understand how their diet was influencing that. So one of their top findings revolved around something called glycemic load. So this is a technical way of describing the amount and quality of carbs that you consume. So it looks at the amount of carbs in a typical serving, and then is looking at how that impacts your blood sugar. It's a relatively new term. You may have heard of glycemic index. Glycemic load takes it a step further. So the researchers found with the Nurses' Health Study that women that were consuming diets really high in glycemic load foods were 55% more likely to have ovulatory infertility compared to women that had a low glycemic load diet. So what does this mean in reality? A high glycemic load diet involves a lot of refined carbohydrates, so white bread, white rice, cookies, croissants, pizza, dried fruit in high quantities. Whereas a low glycemic diet involves eating a lot of grains that haven't been milled, so they still have all their fiber, brown rice, quinoa, buckwheat, fruits and vegetables, oats, those kind of foods. So this really explains sort of what happens when we eat bad carbs, or fast carbs as I like to call them, and good or slow carbs. So with bad carbs, you're eating carbs, they turn into sugar very quickly. Your pancreas responds by producing a hormone called insulin. This insulin is, its primary role is to drive down blood sugar. The body responds by increasing our hunger signals. That in turn increases the risk of overeating, and ultimately over the long term wears out our pancreas. So our pancreas is less able to churn out insulin, and really key is that our cells become insulin resistant. So more blood sugar is going to be circulating. In contrast, we're having some good carbs. They give up their sugars more reluctantly. There's a slower and lower insulin response, and a reduced risk of insulin resistance. So here is just some examples, bad carbs versus good carbs. So why is this important for fertility? So we know that the amount of insulin in circulation influences something called the sex hormone binding globulin. So this is a protein that binds to both progesterone and estrogen. Testosterone and estrogen, but it favors the binding to testosterone. So with more insulin, there's a decreased production of hormone binding globulin. This in turn raises our levels of testosterone, and we know that is responsible for disrupting ovulation and fertility. So a common finding with women that have PCOS is high testosterone. So we know those two things don't jive well. Moving on to another finding, fish, which I get asked about a lot. So in 2001, the FDA put out an advisory limiting fish to no more than one time per week for women who are trying to get pregnant and women who are pregnant. Unfortunately, fish intake dramatically fell because of that statement, but it wasn't backed by much research. So we now know that fish intake is actually super beneficial for fertility and pregnancy. It's now recommended that women have around 2 servings or more per week. Levels of mercury in the study, they found that it didn't make a difference for the time to pregnancy. It's only once you are pregnant. With that said, I always advise my patients to steer clear of the large predatory fish. So swordfish, shark, king mackerel. The reason why fish is so beneficial is due to the type of fat that it contains. So it contains something called polyunsaturated fatty acids. These are the little building blocks that help to form hormones and help with cell signaling. So they really are so key in our diets. If someone doesn't like fish, fish oils can do the same thing. In males, they found that it increases sperm count. And interestingly for males, if they don't like fish, walnuts and other nuts were also found to be beneficial due to the short-chain fatty acids that it contains. I love this graphic from the FDA. I give it out to all my patients. It really it splits up the fish by different categories: best choices, good choices, and then choices to avoid. So to me, this is just as important during infertility as pregnancy. Soy. So that is another food group that I get asked about a lot. It is a very controversial subject. Unfortunately, we don't have that much research. The reason why, if you look up on the internet, a lot of people think that soy is negative is because it's what we call a phytoestrogen. So it chemically mimics estrogen, and it does bind to estrogen receptors. But the Nurses' Health study found it's only in very large quantities that it's actually really mimicking estrogen and upsetting hormonal balance. So on the whole, it's actually showed favorable effects. It's suggested to choose certified organic products. So try and avoid those genetically modified versions that you find in fake meat burgers. It's called soy protein isolate, which you want to try and avoid. For males, there's actually been more research around soy and male fertility. it's been found, they did studies in a lot of East Asian men who have very high soy intakes. They found lower sperm counts. Interestingly though, it wasn't the men in the high soy group, there wasn't a difference to pregnancy rate or the time to pregnancy when undergoing assisted reproductive technology. So that's interesting. So lower sperm counts, but it didn't make a difference to getting pregnant. The other controversial subject is dairy. So again, you'll find a lot of inconsistent research online. The key thing that the researchers found is that it's not the amount of dairy that a woman eats, is the type of dairy, which is very important. So very interestingly, what they found was the women whose diets had the highest amount of full-fat dairy, so for example, whole milk, actually had much lower rates of ovulatory infertility versus those who had low-fat and skim milk products. So the question is why, and it all comes down to how skim and low-fat milk is produced. So if you think, going right back to the beginning, a cow is milked, that milk is then transported to big factories, it's put in separators, it's spun at very, very high speeds. This causes the fat and fat globules to raise to the top. The fat is removed, but at the same time as removing all the fat, you're also removing a lot of the hormones that are contained in the milk, so estrogen and progesterones. It sounds like that would be a good thing. In actual fact, it's detrimental. So what's left in that watery concoction is a lot of a high concentration of male androgens and also something called insulin growth factor 1. We know that women who have a high level of insulin growth factor 1 have ovulatory infertility issues, and it's because you've got that high insulin level, but it's not balanced out by estrogen and progesterone. So it's very interesting. All you need is basically one serving of a whole fat, full-fat milk or yogurt to really kind of keep things in balance. The opposite is true for males. So I would recommend low-fat dairy products because you don't want them to have more estrogen and progesterone, which can throw things out of whack as well. So moving on to the second part, so enhancing egg quality. So this is more relevant for older women over the age of 35. So conventional thinking is women are born with a certain number of eggs, and the quality of those eggs declines over time. So that is true, but it's not the full story. So most chromosomal abnormalities in eggs do not accumulate over the 30 to 40 years of a woman's life. It actually happens in the months before an egg is ovulated. So for most of our lives, eggs are kind of in that immature state. It's only in that 3 to 4 month period before ovulation, when eggs are transforming, that they grow dramatically, and that's when they produce a lot of their energy. So we know that a lot of the reasons why women will have recurrent miscarriages or difficulty getting pregnant is because of the chromosomal abnormalities that occur during that replication period. So we want to try and boost our egg quality. So this graphic I love because it kind of just really shows across the full scan of a year. It's really in this growth phase, those 3 to 4 months before ovulation, when this is the time that we want to try and boost the egg quality. So one of the key things that's been found is the effect of endocrine disrupting chemicals on egg quality. So this term encompasses many different industrial chemicals that interfere with hormonal action. Bisphenol A, BPA, has the strongest link to infertility. So it's actually found that more than 90% of the US population has detectable levels of urinary BPA. Why is BPA bad? It's a weak estrogenic monomer, so it's used to soften plastics, but it has been found to have a really big impact on changing our hormone levels and throwing things out of whack. There was a big public outcry about BPA, so thankfully a lot of products now don't contain it. Unfortunately, a lot of big manufacturers are now using new the kind of offshoots of BPA, so BPA, BPF, and BPS, which have an equally detrimental effect on BPA. So this is just another list of endocrine disrupting chemicals. In addition to BPA, phthalates, which you find in a lot of beauty products, so things from skin moisturizers, shampoos, conditioners, a lot of lotions contain it, pesticides. So as part of the Nurses Health study, they found that women who consumed a lot of fruit and vegetables with high pesticide residues, had much higher rates of pregnancy loss. Very interesting. Lead, PCBs, which are found in primarily meat, but in lots of different food, and dioxins, which are hard to get away from. It's in the air that we breathe in polluted areas. When it comes to BPA, plastic Tupperware and utensils, worst offenders, especially if you're heating them in microwaves. So anything when you're heating things, or if they have liquids or acid in them. So for example, canned tomatoes, a lot of that BPA is more likely to leach into the food. Thermal print receipts. So I always tell people to try and get electronic receipts or wash your hands when you handle receipts. Yeah, and there's a lot out there. It's a lot to do. So I just want to take you on a quick patient journey. Janet was someone that I met a couple of years ago. We started off by doing a discovery call. So she revealed that she'd been trying to conceive for the past 2 years. She got a diagnosis of PCOS, and that was based on high testosterone levels, hyperandrogenism, anovulation, and the appearance of cystic ovaries on the ultrasound. She wanted to optimize her diet and lifestyle and to increase her chances of conceiving and lower the risks during pregnancy, especially gestational diabetes. She weighed 250 pounds. She was on metformin twice a day, which was to help control her blood sugar swings. And her A1C was 5.8. So that put her in the pre-diabetic range. We want it to be lower than 5.7, ideally. So following this discovery call, what I asked Janet to do was to track her food for a week and also fill out one of my nutrition intake forms. So this just gives me more information about eating habits and what her health goals were. During the initial appointment, we did a deep dive into her medical history. We looked at lab results, dietary restrictions and goals. It turns out from her food logs that she was eating a majority of her calories out of the house, and they also had a high glycemic load. She had dieted, and her weight had kind of just gone up and down over the years. She wasn't exercising regularly, and she was also a bit of a picky eater. So what I always do at the end of an initial session is to come up with some practical next steps. So I recommended that she replaced high glycemic foods for low glycemic foods. So corn chips, pretzels, we switched to whole wheat bread, grains. We threw out the soda and juices and switched to tea and water. We also tried to integrate more fish and seafood in her diet. So I created some specific recipes she would like and that were easy to cook. And I also suggested 30 minutes of exercise per day, and then if she can, increasing it to around 40 minutes per day. So I saw Janet for another 6 months. She continued to track her food, and I give her feedback. I encouraged her to integrate more veggies, fruits, grains, and soy. We played around with her meal timing a little bit to try and shift things really early in the morning, making sure that she's having protein at breakfast. We worked on some meal planning. We increased the amount of exercise. We looked at her portion control and also fullness and hunger triggers. And I also encouraged her to track her menstrual cycle because I wanted to see with PCOS, it's important to know if you're ovulating. So in order to know this, one of the ways is to track your basal body temperature. I also reviewed a lot of supplement options as well to see if that would help. So 6 months later, she had lost 25 pounds. She went in for her first round of intrauterine insemination, IUI, and she got pregnant. So I continued to coach her throughout her pregnancy, and before and during her pregnancy, her symptoms of PCOS slowly improved. So she was having less food cravings, she had better skin, and her periods got better. So that was post-birth. So I don't have time to touch on this, but other factors that can increase infertility: micronutrient intake. I always suggest taking a prenatal supplement, body weight over or under, alcohol intake, sugar, exercise, the source and quantity of protein, your levels of stress, oxidative stress, and sleep as well. So here are just some things you can do today. Start taking a prenatal supplement, ideally 3 months, maybe 6 months actually, before thinking about having a baby or doing any kind of egg freezing or anything like that. reducing alcohol intake to get your liver detoxification going, choosing slow over fast carbs, increasing variety in your diet, exercise, and doing a bit of a kitchen and beauty product detox. I think I included a link to the Environmental Working Group's website. That is amazing. It has a beauty database that you can plug in all of your personal beauty products, and it can give you a rating on a reproductive toxicity scale. There is also a company million marker where you can get urinary tests to see how much the level of BPA in your body. So this is just an overview of my preconception program. So it's usually 3 sessions. It's a complimentary discovery call. Then you would complete a nutrition intake form. Initial appointment would be 75 minutes. And then usually I would do around 2 follow-up appointments after that. Thank you very much for joining us. We are offering discounts on the preconception package tonight. And please follow the conversation on Instagram, social media, and talk to all your friends about us. And here are just some helpful resources as well. Thank you very much.